How and when should you really be taking Cialis, also known as Tadalafil? It's one of the most widely prescribed treatments for erectile dysfunction, but here's the surprising truth. Many men take it the wrong way, and that can mean weaker results, wasted pills, and even dangerous side effects. I'm Dr. Jenny Carter, and in this video, I'm going to walk you through everything patients need to know about Cialis, how it works, who it's right for, the safest way to take it, and the mistakes that can quietly sabotage your results. So let's begin with what Cialis actually is. You might also hear it called by its generic name, Tadalafil. It's a prescription medication that increases blood flow to the penis, making it easier to achieve and maintain an erection. Around 6 in 10 men see stronger results when they use it correctly. Cialis belongs to a group of drugs called PDE5 inhibitors, the same family as Viagra. But here's what makes Cialis different. While Viagra works for just a few hours, Cialis can stay active in your body for up to 36 hours. That's why it's sometimes called the weekend pill. But here's something you may not know. Cialis isn't only for erectile dysfunction. It's also used for men with an enlarged prostate who struggle with urination, and even in cases of pulmonary hypertension. That's why it's so important to only get it through a doctor or licensed pharmacist. Counterfeit versions are everywhere online, and you never know what's actually inside those pills. So who should avoid Cialis? This is crucial. If you've had a recent heart attack or stroke, uncontrolled blood pressure, serious heart rhythm problems, liver disease, or vision loss due to reduced blood flow, you should not be taking this medication. It's also dangerous to combine Cialis with nitrate medications for chest pain or with certain recreational drugs like poppers. That combination can cause a sudden, life-threatening drop in blood pressure. Now, how much should you take? For most men, the usual starting dose is 10 milligrams, but your doctor might adjust that higher or lower, depending on how you respond. The maximum dose is 20 milligrams. But here's the rule, you must never break. Do not take Cialis more than once a day. Taking it too often can lead to overdose symptoms like dizziness, severe headache, or vision changes. If that happens, you need to contact a doctor right away. So how should you actually take it? There are two main options. The first is the on-demand method, where you take Cialis at least 30 minutes before you plan to have sex. Once it kicks in, you'll have a window of up to 36 hours where it can support your erections. That means you don't have to rush. You can be spontaneous. The second method is daily dosing. This is better for men who are sexually active several times a week. Taking a smaller dose daily means you don't have to time your pill. You're always ready when the moment is right. Quick note as we continue. If you'd like more clear, science-backed insights to help you take better care of your body and health, especially when it comes to medication, make sure to subscribe. I share practical advice just like this, and there's a lot more to come. Now, here's a question many men have. What should you avoid when taking Cialis? You can drink alcohol in moderation, but avoid grapefruit juice. Grapefruit can interfere with how the drug works and reduce its effectiveness. So how long does Cialis really last? On average, you'll get up to 36 hours of effectiveness. That doesn't mean you'll have a constant erection. It means your body is primed to respond when you're aroused. What about side effects? Many men experience no issues at all, but some of the most common side effects include headaches, nasal congestion, flushing of the face, indigestion, and mild muscle aches. These usually pass quickly, but there are rare, more serious side effects you need to know about. If your erection lasts longer than 4 hours, that's a medical emergency called priapism, and it can cause permanent damage if untreated. Sudden chest pain, vision or hearing loss, seizures, or signs of an allergic reaction like swelling of the face and throat all require immediate attention. So what if Cialis doesn't work for you? This happens more often than you think. Sometimes it's simply the wrong dose, or you didn't time it properly, or you weren't fully aroused. Other times, you may need to switch to an alternative medication. That's why ongoing communication with your doctor is so important. And what about natural or herbal alternatives you've probably seen advertised online? Here's the truth. Most of these are unregulated, untested, and in many cases unsafe. You can't be sure what's actually in them, and they are not approved as legitimate treatments for erectile dysfunction. If Cialis doesn't work for you, your doctor can recommend other proven, safe options. At the end of the day, Cialis can be life-changing for many men, but only if used correctly and responsibly. So remember, take the right dose, avoid dangerous interactions, know the warning signs, and always work with a trusted healthcare provider. Most people think ED pills are all the same, but what if the choice between sildenafil and tadalafil could mean the difference between frustration and true success? For a crucial, expert-led guide on everything you need to know, how they work, the differences that truly matter, common mistakes, and how to choose the right one for you, watch my video. Everything you need to know about sildenafil versus tadalafil for erectile dysfunction. ED pills. It's essential for restoring confidence and connection.